Hi everyone, Dr. Liv here. Today we're diving into a topic that's incredibly important for new parents and healthcare providers alike, birth trauma. While birth is a beautiful and natural process, it can also pose significant stress for both mother and baby. So let's explore what birth trauma is, how it happens, and what we can do about it. Most people assume that birth trauma only refers to extreme or traumatic cases, but that is not the only case. Birth trauma is defined as any injury that occurs during the birth process, and it's surprisingly common. With the increasing frequency of interventions like forceps, inductions, vacuum extractions, and emergency C-sections, birth trauma has become more prevalent. While these interventions can absolutely be life-saving and needed at times, like any medical procedure, they also come with their own side effects. Birth trauma is one of the most overlooked factors contributing to the rise in chronic illnesses among children today. Short-term challenges like lower APGAR scores or difficulty nursing are more obvious, but the long-term effects can be even more concerning. Birth trauma has been linked to speech, motor, social, and emotional delays, sensory processing disorders, ADHD, autism, epilepsy, reflux, and much more. Alarmingly, many cases of birth trauma go undetected or unnoticed and are rarely addressed after birth. But how does birth trauma happen? Primarily, it's physical in nature and can occur in any birth setting. Factors that increase the severity of birth trauma include interventions during labor, the baby's position, size, labor duration, and the shape or positioning of the mother's pelvis. Essentially, the longer and more complicated the labor, the higher the risk of birth trauma. The most impacted system by a difficult birth is the nervous system, especially the autonomic nervous system. This system controls every tissue, organ, and gland in our bodies. When stressed during birth, it can lead to long-term health issues. One key structure affected is the vagus nerve, which regulates our heart rate, breathing, digestion, and so much more. When this nerve is injured, it can lead to colic, constipation, chronic ear infections, sleep difficulties, and sensory challenges. Unfortunately, many of these early signs are brushed off by traditional medical doctors. However, they indicate nervous system stress, which can lead to bigger struggles later in life. That's where natural, drug-free pediatric chiropractic care comes in. As nervous system-focused pediatric chiropractors, our goal is to find and remove nervous system interference through gentle, safe, and effective adjustments. This allows the nervous system to function optimally and restores proper function to the affected areas. Both myself and Dr. Devin are highly trained to adjust anyone from newborns to adults. But let's talk a bit more about the long-term impact of untreated birth trauma. Research has shown that children who experience birth trauma are more likely to face a range of developmental challenges. These can manifest as difficulties in school, problems with social interactions, and even physical health issues like chronic pain or gastrointestinal problems. One of the key reasons for this is the early disruption of the nervous system. When the nervous system is not functioning optimally, it can lead to a cascade of health problems. The vagus nerve, in particular, is crucial for maintaining balance in the body's systems. It helps regulate stress responses, digestion, and even emotional well-being. When this nerve is compromised, it can have widespread effects. Chiropractic care can play a significant role in mitigating these effects. By performing gentle adjustments, chiropractors can help remove stress and interference from the nervous system. This can lead to improvements in a child's overall health and development. Parents often report that their children sleep better, have fewer digestive issues, and are more emotionally balanced after starting chiropractic care. It's important to understand that chiropractic care for infants and children is very different from what adults experience. We use incredibly gentle techniques that are safe and effective for young practice members. These adjustments can help correct issues before they become more serious health problems. We've seen countless families experience positive changes with chiropractic care, from babies who finally sleep through the night to toddlers who overcome chronic ear infections. The benefits can be life-changing. If you suspect that your child is struggling with the effects of birth trauma, please reach out to us for a nervous system scan. Early intervention is key to preventing long-term issues. Thank you for watching, and if you found this video helpful, please like and share it with anyone you think would benefit. And remember, we're here to support you and your family's health. If you have any questions or would like to schedule a consultation, please contact us. We look forward to connecting with you.